Hello, guys. This is Dr. Deborah Durst, owner of Revitalize MD. A little bit about me is I am a traditionally trained MD with 25 years of experience in my specialty of emergency medicine that transitioned into my journey on anti-aging about 10 years ago with a focus on aesthetics and everything wellness and sexual wellness. And so we're going to talk about some things on this podcast, and I have a guest with me today, Samantha Addis.
Hi, everyone. My name is Samantha Addis, and I am the office manager at Revitalize MD. I work very closely with Dr. Durst and her patients on a daily basis, and my main goal is to make sure that everybody's patient experience at the office is top-notch and the best that it can be. So what do you want to talk about today, Dr. Durst?
So I was thinking we see as many men as we do women, but this last week has been very busy with male patients. And so I wanted to talk about that a little bit. I love seeing men come into the office, and it's so refreshing to see how comfortable they are at asking questions, having conversations, and seeking solutions for some symptoms they might be feeling. So I wanted to talk about that a little bit today.
So what symptoms do you start hearing men complain about as the hormones start declining and aging?
So I think that testosterone is the primary hormone in men, and it is life force for men. So I think that the big complaints are mood. Sometimes it can even be depression, but it's really kind of they lost their edge, is how I would describe it. And so again, brain fog, low energy, maybe some weight changes, low sex drive, and sometimes even some sexual functional changes are a frequent complaint.
And then is this something that primary cares are testing for, like all these symptoms? When a primary care hears that they're having depression or weight gain, do they think that it could be a hormonal imbalance, or what is their first thought on that?
So I don't think that primary doctors address it as well as they should. I think it depends on your primary care doctor for sure. But frequently when they go in complaining of, again, weight changes, maybe some increased subcutaneous fat, I'm not building muscle as much, I'm not thinking as clearly, I have a low sex drive. Low sex drive kind of alerts the primary to maybe test testosterone. But when they do, what happens is you have a wide range of a testosterone level. So say the range, for example, is maybe 250 to 1,000. They may have been in the 900 range and now are 300, but they're still within that normal range. And so they'll be told that it's normal by their primary care doctors. And so that is a frequent finding, is that they'll do the test, especially when there's maybe a low sex drive, but then they're not given appropriate solutions for that. And so that's where I think they start to seek other solutions, either with our office or maybe the low T centers,
And what do you feel, or what are your opinions on the low T centers?
So I think, again, there's low T centers for men and popping up pretty much everywhere. So at least there's an educational component of the public about low testosterone and symptoms you might feel. And again, those symptoms are low energy, brain fog, some weight changes, increased mid-abdominal, weight gain, decreased muscle mass. My workouts aren't as good. But again, that low sex drive and sometimes some erectile changes might be common. And when they don't get the answers for the primary doctors, they're doing such a good job with education from a low T standpoint, and those centers are in lots of locations
there's a lot of
that they can go in and at least have some solutions. The problem is it's pretty standardized that almost everybody's getting the same type of treatment. So maybe once weekly injections, they'll put them on some pills that work with the injections to prevent some, conversions and side effects. But it's pretty common that everyone's almost getting the same treatments. And so I think it's more of a one size fits all. And that's my issue with low T centers.
Okay. And in men, I know women are much more complex. Are you only looking at testosterone, or is there other certain hormones that you're also testing as well? Because women, there's tons of different ones. But I didn't know if men have more.
It's a good question. And, so that testosterone is the primary hormone with men. So it does make hormonal replacement therapy a little easier from the number of hormones we're balancing, where women have estrogen and progesterone, and men do have conversions to estrogen that we need to manage, but at least testosterone is the primary hormone. Of course, cortisol is a hormone and a stress hormone, so we do look at that. We look at other things that might affect testosterone, and testosterone, when we give it, we really want it to stay testosterone, but it can convert to other things. One is a metabolite of testosterone that's stronger, so they feel better on it, but sometimes they might get some side effects with it. So managing that conversion is important, which I think, again, they don't do as well at a low T center at, measuring that metabolite. And then also they can convert to estrogen. So the big thing is estrogen does need to be watched. Even though it's not the primary hormone we're treating, we do need to watch that conversion, because once it happens, then it's hard to control the symptoms that they develop with that, such as breast tenderness or enlargement.
Yeah, I thought you could correct me if I was wrong, but that does make them have boobs. Yeah.
Well, and that's a good way, and they actually really understand that terminology. Yeah. And once you get, breast enlargement or man boobs, as men frequently refer to it, or even just tenderness, it's hard to treat that and reverse it. So you definitely want to prevent that from happening. And so frequently they give them injections and some pills that help manage that conversion, where I like to handle that differently, where I'm actually compounding some stuff with the testosterone to prevent that conversion.
It's all bioidentical too. It's matching their old testosterone. You're just getting them back to where they were.
Yes.
Through these injections or pellets.
Well, the nice thing about, hormones now is it is bioidentical. Technically, injections aren't bioidentical because there's a cypionate or another salt that needs to be metabolized off for you to get testosterone. So it really is meant for more a short-term use, because your liver has to metabolize that off to get the testosterone. But pellets are completely bioidentical. So you're using testosterone, and again, there's creams you can use which are bioidentical. Again, skin's meant to keep things out, so it doesn't frequently treat it as well. Your levels are up and down. You get some more conversions than you would with other treatments. And then injections, again, more of that up and down, more conversions, more side effects. And pellets, you go up and you stay up. And so with that, you get less in the way of side effects, and it is bioidentical completely.
And then other than the, man boobs, what are some of the negative side effects that make people a little bit scared about testosterone and how safe it is?
So some things you definitely want to manage and watch blood work closely when you're doing testosterone. And you can get an elevation in hemoglobin and hematocrit. And again, more likely with injections if not managed correctly, because you go up and then you go down with injections and up and you go down, and where you're up and more stable and steady and consistent with pellets, so less conversions. But if your hemoglobin and hematocrit go up, you basically have hemo concentration. And so a lot of times people will have to have some blood drawn for that. So it's better to manage those so that it doesn't happen, or if it happens, you're treating it. Estrogen, again, with the man boobs is an emotional, as well. And it's hard to time pills with injections that are kind of pretty just cookbook from a low T center and managing that conversion the right way. And then likewise, men are frequently concerned about prostate issues. And so it doesn't cause prostate cancer, but it can cause a cancer to grow if it's there. So we have to watch the prostate. So we're frequently doing PSA tests with it and in making sure that there isn't an elevation that's concerning, because at that point they would need a urologic consultation.
Okay. And I know when I answer phones and I hear men say that they're experiencing low energy, weight gain, that is a lot of the things that I hear. But what do you think is the biggest driver for people wanting to get onto testosterone therapy or wanting to know more about all this?
I think that frequently it's just that lack of vitality, lack of like drive. Men are competitive, that's part of their DNA. And so it's their life force. And so when they lose that edge, they frequently are looking to get that back in some way. And again, testosterone is one of those ways, and it helps with mood. It helps with that life force. It helps with that drive and competitive nature that men have. But likewise, I think that erectile changes are a common reason that men seek testosterone replacement. And testosterone, again, does have that libido and sexual function component, but that's not the only thing. But I think that does, obviously, drive a man to seek solutions when they're noticing some changes, because that likewise is central to a man and enjoyment in life and, and what he's used to. So, and I think, as you see, we see patients kind of two spectrums. Like somebody will come in seeking hormone replacement because they've looked at what might be causing their symptoms. So they come in for hormone replacement. And then we're having those conversations because they have some erectile changes. And so then we have functional and regenerative changes that we can do to help with that. Or they're seeking treatment because they have erectile changes. And now they've looked at it and they found solutions. So they come in for maybe Gainswave or, P shots. And then we're talking to them about hormones, because likewise, if we do all those treatments, you're not going to get sustained results unless if we have cellular optimization of your hormones. So it ties in. So I think the two big things that it's either that kind of life force, lack of drive, mood changes, or really erectile changes that drive a man to seek solutions and make appointments.
So the next steps for anyone who is looking to get testosterone injections or just see where their hormones are at is to reach out to the office. You can call, text, email us. You can also message us on our social media accounts, Facebook, Instagram, YouTube. And it's really to get you in for a consultation. We go over your symptoms with Dr. Durst. She really finds out what the best treatment plan she thinks is for you. We'll get blood work and so on. So the first step is just get in for a consultation with her.
And so likewise, if you like, subscribe, and definitely share with your friends, and let us know in the comments if there's anything else you want to hear about, because we are willing to dive deep into anything and everything wellness, aesthetics, and sexual wellness. And we're not afraid to talk about anything. So we're here to revitalize your look, your health, and your sex life.